Welcome to an overview of Tier 3 of the West Virginia Expanded School Mental Health Framework. In this video, we will take a closer look at implementing Tier 3 intensive treatment programs, including mental health therapy. We will discuss what Tier 3 looks like, what it is all about, important components, and expected outcomes. The West Virginia Expanded School Mental Health mini-webinar series covers 12 topics that will help schools and their partners gain a full understanding of the expanded school mental health model and prepare them for implementation. This video is the fourth in that series. I'm Garrett Kiefer, HHR Specialist Senior with the Bureau for Behavioral Health in the Office of Children, Youth, and Families of the West Virginia Department of Human Services. This video series is presented by Marshall University School Health Technical Assistance Center, Division of Community Health in the School of Medicine, with funding from the West Virginia Department of Human Services, Bureau for Behavioral Health. Our learning objectives are: 1. Increase understanding of Tier 3 of the West Virginia Expanded School Mental Health Framework, and 2. To provide relevant resources. Let's do a quick review of the 3 tiers of ESMH. Tier 1 serves all students and includes universal prevention and promotion of mental wellness. Tier 2 provides early intervention via selective and indicated supports for at-risk students who are identified with behavioral, academic, attendance, or emotional needs. Tier 3 is the most intensive level of intervention. Services may include clinical mental health therapy and/or intensive interventions that are provided by qualified mental health professionals in a school setting during the school day. This video will focus on Tier 3, which serves students with diagnosed behavioral, developmental, or mental health conditions. Tier 3 is about providing individualized, medically necessary services to students with clinical, mental, or behavioral health needs. Schools identify these students based on observed individual student behavior. Students may receive a combination of services such as individual, group, or family therapy, psychological or psychiatric evaluation, psychiatric medications that may or may not be administered at school, and accommodations on the student's 504 or IEP. The purpose of Tier 3 services is to help youth overcome limitations that impair their functioning. By working together, mental health providers and school staff can develop strategies to improve functioning in the student's natural setting, to treat disorders, and quickly adjust strategies to enhance student success. What does Tier 3 look like in schools? Referrals are typically made by Tier 2 facilitators, school staff, parents, student self-referrals, or via data from screening and observed functional difficulties. Some students transition to school-based therapy from outpatient clinic settings. Services are usually provided by a community mental health provider that has entered into a memorandum of agreement with the school. Tier 3 requires guardian consent for treatment and is delivered by credentialed clinicians such as licensed professional counselors, licensed social workers, certified addictions counselors, psychologists, or other qualified mental health professionals. Students receive Tier 3 services on school grounds during the school day with medical excuses for missed class time. This intensive level of support is generally needed by 5% or less of the student population when Tiers 1 and 2 are implemented well. Tier 3 services are most successful when teams include these important pieces of implementation. Although some schools may prefer to provide intensive services with their own personnel, this is a difficult process and rarely sustainable in West Virginia. Tier 3 services are most successful and sustainable when schools have formal collaborative agreements with community mental health providers. These providers are adept at navigating third-party billing, Health Insurance Portability and Accountability Act, also known as HIPAA, privacy requirements, and legal issues associated with mental health care. Schools and providers must work together to develop a formal process for identifying, referring, and following up with students to ensure those in need gain access to services in a timely manner. Schools that have built strong relationships with families can facilitate referrals by connecting students' guardians with mental health providers to support the student. This approach helps to normalize mental health care and reduces the barriers associated with obtaining the guardian's consent for treatment. It is important to integrate provider clinicians into the school environment by involving them in normal school activities. When families see clinicians at open house, sporting events, dances, parent-teacher conferences, after-school programs, and other school events, stigma associated with mental health services is reduced and greater sense of trust is developed. These efforts improve the likelihood of engagement in treatment. Schools must provide a private office where clinicians can provide Tier 3 services to students without risk of being overheard by other people. The office does not need to be large, though it's best if 3 or 4 people can sit comfortably so that family members may join sessions as needed. The clinicians require internet access and phone service through the school system. Computer equipment and furnishings are generally provided by the clinician's employer. HIPAA safeguards patient health information, while the Family Educational Rights and Privacy Act, also known as FERPA, safeguards students' educational records. Although both laws aim to protect individual privacy, they differ in the types of disclosures they allow. To facilitate information sharing between schools and community mental health agencies, it is essential to obtain release agreements. These agreements not only ensure compliance with HIPAA and FERPA, but also streamline the coordination of care and services for students. However, schools must recognize that specifics regarding mental health treatment will remain confidential to uphold the student's privacy. Clinicians must provide written excuses for each session provided to students during the school day with start and stop times included. Schools must honor these excuses for absences or tardies associated with Tier 3 services as they are medically necessary and equally as valid as dental or primary care appointments. Clinicians must optimize third-party billing in order to sustain Tier 3 services. Schools and families need to understand that these services are billed to insurance and copays may be necessary. A sliding fee scale may be available with some providers. In the event of a crisis at the school, clinicians should assist in managing the situation, even when the students involved are not active clients. Many times, these clinicians have specialized training and their support is both needed and invited by the school. What outcomes can we expect from good implementation of Tier 3 intensive treatment? Students receive services in their natural environment, which makes the development of rapport with their clinician easier and allows for more accurate assessment of the student's behavior. When students receive the treatment they need, their functioning is improved and they are less likely to experience a crisis. Since students receive Tier 3 services at school, transportation is no longer an obstacle. This allows them to engage more effectively in treatment compared to traveling to a clinic. Additionally, guardians are typically only required to attend the initial case opening and to periodically review treatment progress. Furthermore, students generally miss just one class period for each session instead of an entire day, minimizing out-of-school time and loss of instruction. The West Virginia ESMH website has many resources and tools for your convenience, including detailed information about our framework, a 10-step implementation guide, approved evidence-based programs per tier for grantees, an extensive resources page, and a news and events page where you can see highlights from ESMH and AWARE grant sites, as well as upcoming trainings. We encourage you to check out all of our videos on the Marshall University School Health Technical Assistance Center's YouTube channel. Thanks for joining us to learn about Tier 3 of the West Virginia Expanded School Mental Health Framework. Check out our other videos in this series where we explore different components of the West Virginia ESMH framework.